When you looked at the mirror, you notice a small ugly lump in nostril. That can be a nasal polyp. A week later the lump can grow to about 1 centimeter in size. It can completely blocks in your nostril. You may be very scared, as your first thought, that it could a tumor. Nasal polyps are non-cancerous. They are benign growths of the lining tissues of nose. However, if you saw a doctor, he would tell you that you should get a nasal surgery. Before getting that scaring medical operation, you had better realize these. One fact you have to know: surgery is not necessary. It is not a permanent solution to nasal polyps. Majority of the patients will experience a recurrence in a few weeks. When a recurrence occurs, generally the polyps will be larger than they were before the surgery. Another thing you have to know: do not use steroids for nasal polyps. Steroids in the form of tablets, creams, and sprays fail to tackle the root cause of the polyps. They often can cause a myriad of side effects. Steroid can lead to a weakened immune system. They cause the damage to the nasal environment. They result in chronic inflammation, and can trigger asthma. Also, you have to know the best solution to get rid of nasal polyps is by tackling the underlying irritation and inflammation. There are a number of different causes for nasal polyps, but what causes them to grow is irritation and inflammation of the nasal lining. Therefore, the only way to treat nasal polyps effectively is to remove the factors that causing the irritation or inflammation. So, if you want to cure your nasal polyps permanently, you have to remove all the factors that irritating and inflaming your nasal passages. You have to make sure that your body keeps in an anti-inflammatory state. For more detail how you can get rid of nasal polyps effectively and permanently, see the link in the description below.